You tell me when I can actually say anything. Can people hear me right now?
You can talk.
Okay. Yeah, just a minute away. Now when she presents, do I turn myself off? Or am I still there all the time? So when do we see her face?
She's got to share her webcam.
Right. Do we expect her to turn it on? Don't we expect her to turn it on?
She's got to, on her end, she's got to everything with her end. She's hosting it, so she's got to do it on her end. So she's supposed to share the camera, all of this is on her. Our end, we're covered. She's got to do her part.
How come I don't see her? How come I can't see her?
She needs to share her camera, same like I did this. She needs to do that on her end.
Right. So do we do that now or wait?
She needs to do it, not us.
No, do I need to tell her?
Yeah, obviously, yeah, if you want to. So tell her she needs to share her webcam on the side.
Right. Good afternoon. Excellent. Kathy Ride. Kathy.
Hello, Renee.
Hi. You need to share your webcam. Share it for us to see you, Kathy. That's it. Perfect. Well done. Well done. Well, good afternoon, everybody, and welcome to our webinar from the University of Sydney. Firstly, I'd like to acknowledge the traditional owners of the land which we are at Sydney University, which is the land of the Gadigal people of the Eora Nation, and it's very interesting that we're able to share our information and acknowledge the sharing of this information, and how extraordinary to be doing this all around Australia. So I'm very pleased that we've been able to do this. Quite complex technology going on here with Kathy Wright and her team. Kathy, for those who know this and have looked this up, is the project officer from the HealthInfoNet, and who we've had quite a few interactions with, myself in particular, with regard to the project of changing the rates of tobacco use nationwide in our Indigenous populations. And so what we've been able to do today, and hopefully it all works for those who've never done a webinar before and never seen how this works, is to be able to share this site for Kathy and her team, and she'll introduce her co-workers, to share to look at the webinar, to look at the site that's available to everybody, nationally, of course, internationally. And if you have any questions, there is this chat section there. Ideally, if you could leave your questions, and I think Kathy will reiterate on this too, till after the presentation if you've got any questions. So I'll leave it now to Kathy to introduce this wonderful website, and to discuss with you what is accessible to you and what is available to all of us to use. Kathy, thank you so very much for doing this.
Thank you, Renee. I would also like to start by acknowledging the traditional custodians of the land that we are on today, and all our listeners today, and pay our respects to the elders past and present. My name is Kathy Ride. I'm a research team leader at the Australian Indigenous HealthInfoNet, and this is my colleague Millie, who is a research officer. We work at the Australian Indigenous HealthInfoNet on the Australian Indigenous Alcohol and Other Drugs Knowledge Centre. Millie and I will be co-presenting for you today. So today we're going to do a live demonstration of our website, and So you'll see the website on your screens, and we encourage you to, if you have another machine, that you could have a play while we're going through and demonstrating for you. The aim of the session is to show you the many resources that we have relating to tobacco use on our website, and to guide you in how you can use them most effectively in your work. As Renee said, we'd prefer to do the questions at the end, so we'll have about 10 or 15 minutes question time. And as Renee also said, you do in your questions by typing them in. Okay, so we'll start our presentation now, and we'll switch to show you the website on your screens. Okay, so today we're going to introduce you to the HealthInfoNet, the Preventing Maternal Smoking portal, the Workers portal, the Community portal, the Tobacco section of the AOD Knowledge Centre, and the Tackling Indigenous Smoking portal, which we also call the TIS portal. But first of all, I'd just like to talk to you about why smoking is an important issue. As you may know, tobacco smoking is a significant risk factor for Aboriginal and Torres Strait Islander people, with rates of smoking in these communities reported at higher levels than in non-Indigenous communities, especially in rural and remote areas. Smoking is the leading contributory risk factor to the gap in health outcomes between Aboriginal and Torres Strait Islander people and non-Indigenous people. The recently released Australian Burden of Disease study by the Australian Institute of Health and Welfare identified smoking as being the greatest risk factor contributing to the burden of disease for all Australians at 9%, with smoking contributing to 36% of the respiratory burden and 22% of all cancer burden. In 2003, it was responsible for 12% of the total burden of disease for Aboriginal and Torres Strait Islander people, and accounted for around 1 in 5 deaths. Given the much higher rates of smoking amongst Aboriginal and Torres Strait Islander people, we can expect the burden to remain very high when the Indigenous statistics are released, hopefully later this year.
So now I'd just like to give you a quick introduction to the HealthInfoNet. This is the homepage that you can see here. It is a website that contains information about Aboriginal and Torres Strait Islander health. We are physically located at Edith Cowan University in WA at the Mount Lawley campus, but as a national internet resource, we could realistically be anywhere in Australia or even overseas. The HealthInfoNet was founded in 1997 in the early days of the internet by the then director, Professor Neil Thompson. Its main function at the time was as a clearinghouse for publications, journal articles, reports, etc., to make them accessible to people working in the area, such as academics, policymakers, government workers, students, and frontline workers. Since that time, the HealthInfoNet has grown exponentially to be the website it is and you see today. Our two key areas of focus are to provide access to best available research and other information, which enables evidence-based or evidence-informed decision-making, and to conduct translational research, also known as knowledge transfer or knowledge exchange, which involves making research and other information available in a form which has practical immediate utility. To do this, we collect relevant research and other information relevant to the health of Aboriginal and Torres Strait Islander people. We collate, translate and synthesise the information we gather to create new and more accessible knowledge about Aboriginal and Torres Strait Islander health, and we also disseminate the information, primarily via the internet. The HealthInfoNet covers over 30 different health topics, which you can see along the top here, such as chronic conditions, infectious conditions, social and emotional well-being. We've got protective and risk factors such as nutrition and physical activity, and we've also got a section specifically created for people working at the front line, such as Aboriginal and Torres Strait Islander health workers and Tackling Indigenous Smoking workers, which you can also access from this portal section down the bottom here. So first off, I'd like to show you the Preventing Aboriginal Maternal Smoking in WA portal. This was funded for 18 months by Healthway. the West Australian Health Promotion Foundation. It was created as part of a collaborative project with Curtin University and the Aboriginal Maternity Services Support Unit at King Edward Memorial Hospital for Women, which is WA's largest maternity hospital. The target group for this portal are maternal and child health workers who work with pregnant Aboriginal and mothers. The portal homepage opens to this page layout accompanied by the beautiful artwork titled Seven Sisters by local WA artist and author Josie Boyle. Pansor has a 3 gecko rating, which you can see up the top here, which means it features links to a newsfeed, Yarning Plays Twitter account, and also has newsletters to share information. From the homepage, you can explore the following: key facts, which has a fact basically about Aboriginal maternal smoking and the associated health risks. So if you scroll down, we can have a quick look at these. We also have programs and projects with a range of current and completed programs. So if we'd like to take a look at one, we can have a look here. And this is basically what all of our programs and projects look like. So they have an overview, contacts, and also any related and evaluated publications and links for further information. We also have an organisations page, which has links to service providers and organisations which are mainly West Australian, as this is a West Australian portal. We have a publications page, which leads to a list of relevant up-to-date reports, journal articles, research findings, and other great literature about Aboriginal maternal smoking. We have a resources page, which will link you to health promotion and health practice resources. And as you can see, there's a list here of health promotion resources. And lastly, we also have a workforce section, which offers users access to the latest courses and training, conferences, and job postings. So if we look at courses and training, there's a list here of current courses that anyone can get involved with.
Now we'll move over to the Australian Indigenous Alcohol and Other Drugs Knowledge Centre, which you can access from the HealthInfoNet homepage. The Knowledge Centre was launched in 2014 with funding from the Department of Health. It provides specific information about alcohol and other drugs, including tobacco, alcohol, illicit drugs, prescription drugs, and volatile substances. The Knowledge Centre is managed by the HealthInfoNet in partnership with 3 national research centres: the National Centre for Education and Training on Addiction in Adelaide, the National Drug Research Institute in Perth, and the National Drug and Alcohol Research Centre in Sydney. It's also guided by a national reference group, which includes a range of professionals in the alcohol and other drugs field, including Aboriginal and Torres Strait Islander professionals. Today we'd like to show you the tobacco section. The tobacco section has the same features as most of the other topic sections on the Knowledge Centre, and they're all displayed in a similar way. This consistency from one section to another makes it easier for our users to find their way around the website. From this page, you can access policies and strategies relating to tobacco smoking among Aboriginal and Torres Strait Islander people. We have a publications page, which is a collection of around 350 publications specific to tobacco use in the Aboriginal and Torres Strait Islander population. We have a resources section, which contains both health promotion and health practice resources, including brochures, guidelines, toolkits, videos. We have a programs section, which is a collection of programs and projects which can be sorted by education, treatment and support, and research. In the organisations page, we have a collection of organisations working in the area of tobacco use or tobacco cessation for Aboriginal and Torres Strait Islander communities. And the workforce section has courses, information about courses, job opportunities, conferences, workshops and events, or funding that's relevant for the smoking cessation workforce.
So now we'd like to just quickly move on to the AOD Workers portal, which you can see here. This portal was created in partnership with the University of Sydney's Indigenous Substance Misuse program. Material for the portal is largely based on their Handbook for Aboriginal Alcohol and Drug Work, which was published in 2012. And this is the handbook here, which you can also access down the bottom here too. The AOD Workers portal is a plain language portal designed for AOD workers. The portal provides information on 16 different topic areas, which you can see here, including tobacco. The information on the portal is material that will be practically useful for any AOD worker in their day-to-day work. In each section, for example, looking at the tobacco section, there is a section for publications, health promotion resources, health practice resources, and programs and projects, and also a tips for workers page, which has been developed to provide key information that workers might need to know when working with a client who is a smoker. So this is the page here. Lastly, in the Workers portal, there is also a special section on taking care of yourself, which has been developed in recognition of the stressful nature of the work that AOD workers do. If you click on Tips for Workers here, there is a special section which talks about why worker well-being is important, what is work-related stress and burnout, and from this, we also have the community portal.
They're fading away.
Vital role community and family relationships have in the prevention and treatment of alcohol and other drug problems. We conducted several focus groups in Sydney, Adelaide and Perth with AOD workers and community members, and the portal was developed from the feedback that they provided. A key feature of the community portal is a plain language fact sheet on the effects of alcohol and other drugs, which you can access on the side here. And this is the topics that we cover. There's one specifically developed for tobacco, which you can access here, and it provides information on what is tobacco, how does it work, and more. There's also a videos page, which you can access here, which is a collection of promotional resources categorised by key area of concern, including tobacco. Lastly, on the community portal, there's also these sections down the side here, which cover topics such as help for families, help for young people, and help for offenders. This is the Help for Young People page, and as you can see, there's quite a bit of information about specific substances, and also a list of programs that can help young people address their issues with alcohol and other drugs.
Now we're going to move on to the Tackling Indigenous Smoking portal. This portal has been developed as part of the HealthInfoNet's commitment to the National Best Practice Unit for Tackling Indigenous Smoking, or the NBPUTIS, which we're a member of. Ninty One leads the NBPUTIS, and the other members include the Health Research Institute at the University of Canberra and the Smoking Research Unit at the University of Sydney with Renee. The TIS portal contains specific information for organisations funded through the National Tackling Indigenous Smoking program, which is a Department of Health initiative. But it's also relevant for anyone working to help Aboriginal and Torres Strait Islander people to quit smoking, or for organisations trying to reduce the prevalence of smoking in their communities. The TIS portal's key feature is the Tackling Indigenous Smoking Resource and Information Centre, or the TISRIC. This is where those organisations will go for best practice information about what works when they're tackling smoking in Aboriginal and Torres Strait Islander communities. The TISRIC has been developed and written especially for the portal and includes information on how activities and programs can be adapted to meet the local needs of people and communities. It also contains important information about how these organisations can monitor and evaluate their programs with an outcomes-focused approach. Other features of the portal include a workforce information section, an events section, and videos. We'll go into more detail about each of these sections in a moment, but first we'll highlight how the TISRIC supports best practice in tackling smoking. There are 4 key sections to the TISRIC, which are ideally meant to be used to guide the TIS workers during whatever stage they are at in their program. So there's planning, activities that work, resources that work, and does your program work, which is the monitoring and evaluation. Under planning, the section is designed to assist the TIS workers with planning and implementing evidence-based approaches to tobacco control. It focuses on providing information for planning tobacco control programs to meet the specific needs of people and communities in each TIS area. There are practical tools and examples of how to develop tobacco cessation programs. There are 4 key areas which you can access by clicking on the drop-down headings. The Activities That Work section provides general advice on what information currently exists about smoking cessation for Aboriginal and Torres Strait Islander people and how it can be applied in a practical manner. Key information covered by this section includes brief intervention, counselling, quitline, developing programs for specific groups such as young people and pregnant women, using physical activity to support quitting, using social media, running smoke-free events, and supporting smoke-free workplaces. In each section, information is provided about what work may be currently being done in this area, programs that have been found successful in this area, and general information and advice. Resources relevant to each topic section can also be found on each of these pages. How does your program work? This section provides tools and information that TIS workers can use for monitoring, measuring and improving any activities they're undertaking as part of their TIS initiatives. This section is split into 3 areas which focus on the basics of monitoring and evaluating the project, or why you should think about monitoring and evaluation and when to start thinking about it. The TIS specific evaluation, which is how the TIS program will be evaluated and the performance indicators developed by the Department of Health. These can be accessed by clicking the drop-down heading for each indicator. And monitoring and evaluation methods, which focuses on the different ways in which TIS workers can monitor and evaluate their program and focuses on different data collection methods, such as case studies, surveys, or focus groups. Finally, in the Resources That Work section, this has been split into 3 different sections to support the 3 sections previously discussed. So there are resources specifically for planning, for conducting activities, and for monitoring and evaluation. These range from templates to support developing a smoke-free workplace, health promotion resources to use when working with pregnant women, practice guidelines such as on using nicotine replacement therapy, and fact sheets on conducting a focus group or a guideline on tobacco control audit tools and protocols. So that's it for the TISRIC. Now we'll move on to the sections that provide direct workforce support.
So this is the workforce section of the TIS portal. In this section you'll find things like job opportunities, courses, training and funding opportunities, all relevant to smoking cessation for Aboriginal and Torres Strait Islander people. For example, if we want to take a look at the job opportunities page, you can currently see that we've got 1 vacancy listed there. And we also love to promote the vacancies that any TIS workers might have. So if you have any vacancies, we're really happy to promote them for you, and we do so free of charge. There's also an organisations page, which is a list of organisations who are working on tackling tobacco in Aboriginal and Torres Strait Islander communities, as well as the organisations currently funded under the TIS program. It's also worth noting that there's a funding page, which contains a list of funding opportunities that TIS or other organisations can apply for if they require funding for smoking programs in Aboriginal and Torres Strait Islander communities. So if you'd like to take a look at one of these funding opportunities, you can see that here. There's also a training page, which is a list of training opportunities that people and organisations can use for professional development or to upskill. There's also this events page, which you can access on the side here. Key area that we'd like to touch on, which contains a national listing of conferences, workshops and events relevant to tobacco and smoking. As you can see, there's a couple of events on that page, which can be sorted by date, title, location or content. We're also really happy to promote your workshops and events on here, so if you have any that you'd like to promote, you can get in touch with us as well. Another important section on the TIS portal is the videos page. This is basically a collection of short videos promoting quit smoking messages such as the Deadly Choices ads, as well as examples of community-based productions encouraging people to quit smoking. This section will eventually house videos produced by our Tackling Smoking organisations about their own programs, about what works, what doesn't work, or about their experiences that they might like to share with other workers. We'd encourage you to get in touch with us if you think there's any videos on there that should be added as well. Finally, the last section to look at is the programs page, which is a list of evidence-based programs that have been found to be successful in tackling smoking in Aboriginal and Torres Strait Islander communities, and these will be similar in layout to the other programs page which we looked at before. So that's it for the TIS portal. Obviously there's a lot of content in there that we don't have time to actually go into today, but we'd encourage you to get on the portal and have a look for yourself as well. We'd also like to look at some of the HealthInfoNet social media products, one of which is the yarning places. The HealthInfoNet has established these yarning places, which are known as online networks for people from different states, territories, regions and sectors to share information, knowledge and experiences. We currently host 18 different yarning places, which you can see down the side here, and these cover a variety of different topics, including one specifically for the Knowledge Centre and one as well for the TIS portal. Each yarning place is free to join and has a couple of key features which we'll take a quick look at. So this is the Knowledge Centre yarning place. On the main page here is the yarning board, which is similar to a message board where you can post a topic, say you wanted to ask a question, or answer someone else's question in your own time. There's also the events section, which is basically a listing of events relevant to Aboriginal and Torres Strait Islander alcohol and other drug abuse. These can be added by HealthInfoNet staff, or if you have an event also that you'd like to add, you can do that yourself. Lastly, there's also the Yarn Now section, which is basically like a live feature where you can chat to other people in real time. There's lots of different yarning rooms that you can jump into and have a chat with people in your own time. I'd also note that the TIS yarning place, which is down the bottom here, has been specifically developed for TIS workers, and so membership is restricted only to those funded under the TIS program. However, the Knowledge Centre yarning place is open to any and all, and we'd encourage you to join and get involved. If you've got any questions about the yarning place, I'm happy to answer those, so please get in touch with me at the end of this webinar.
Now I'd like to tell you about our newsletters. The Knowledge Centre sends out a newsletter each month that focuses on a different area of alcohol or other drug use. The newsletters contain information about what's new on the portal, including news, job opportunities, publications, resources, programs. If you'd like to subscribe, we can post a link for you at the end of the webinar. There's also an NBPU TIS newsletter as part of the TIS program, which you can sign up to if you're interested. We'll provide the sign up link to that one at the end of the webinar as well. The Knowledge Centre has its own dedicated Twitter account, as does the NBPU TIS. You can follow these accounts for the latest information about alcohol and other drugs or smoking cessation. We post topical and timely information on these accounts which might be relevant to you in your work. So that's a quick introduction to the tobacco information that we provide on the HealthInfoNet and the AOD Knowledge Centre. We've actually done it in really quick time, and we've covered quite a lot of information. So we encourage you to visit these two websites in your own time and have a good look around. And if there's anything that you think should be on either of those websites that isn't there, then we love to hear from our users. And so you can contact us directly through the HealthInfoNet contact page.
Jerome, I think they're actually done. Shall I go to start my webcam?
We can also, if there's anything specifically that people would like us to go back to and show you now, we're very happy to do that too.
Thank you so much, both of you. That's just, hopefully you can hear me, and that's, was a really in-depth website. It's just fantastic. I can't say anything else but congratulations to all of you for having developed such an extraordinary resource. Are there any questions from the group that are logged on? Type them in, please. I guess I have a question, if that's appropriate, just while we're waiting for other people perhaps to think about their questions. How would you actually make a comment like updating material that may, for some of our group, seem out of date, or how do you go about updating material?
Millie's just showing you now, we have a Contact Us page in the footer of both the Knowledge Centre and the HealthInfoNet main website. And this is the page you get, so you can put in any information that you want. You can have a query, or you can put in some information, or whatever you want to share with us. And so that goes to our general email account, and it will be sent to the appropriate worker who can answer your question.
And also add content, is that correct? You'd be adding content.
Yes.
Essentially, helping to add content.
Yes.
That's fabulous.
I think your name was Angel, sorry if I've pronounced that wrong. You can't actually upload the content yourself, but so if you send it to us, then we upload it for you. So as we showed you here, if you go to the homepage of the website, you scroll down, there's a Contact Us page, and then you just put all the information in that contact field and we'll upload it for you.
And if we need more information, because we've got your name and email, we can contact you to get more information if we need it. And what we always say is that anything on the HealthInfoNet and on the Knowledge Centre is information that is available nationally anyway. Most of it's on the internet somewhere. And we have a dedicated team of researchers who spend hours every day identifying new material to go on the website. But there are always things out there that maybe aren't available on the internet. Maybe you've written a report that hasn't been published, or there's some kind of an article that you've written, or you've run a program that hasn't been written up. If you want to share that, then we are more than happy to publish that on the website. But the only way we're going to know about it is if you tell us about it. So we encourage everybody out there to keep us informed about what they're doing, what they're working on, what they're writing, what they're publishing, and just so that we can make sure that we have it here on our website. We have a question here from Paul Camp. He says, other sites seem to downplay the use of NRT and pharmacotherapy in Indigenous smoking cessation. Renee, I don't know if you have any comments on that.
Oh no, I can't say. This is extremely good. I mean, the pharmacology here is excellent. The commentary is fine. I think it's covered particularly well here. There may be other pharmacotherapies that are not necessarily given enough. If you can scroll down a bit further, could you just keep scrolling down? That's right. And maybe keep going. And you've only really covered one form of pharmacotherapy, really. So perhaps there should be more of other treatments available, like varenicline, which doesn't get a lot of not a lot of commentary. And of course, there's a lot of expertise watching this today. Just thought I'd mention that. People like Paul Camp, who you may not know of, and others who are really long-standing members of our tobacco treatment groups, who might feel inclined to contribute their experiences. And Maria Willis is also another person who's made a comment, BJ as well, and making commentary to you, have had a lot of experience using pharmacotherapies other than, and maybe helping debunk some mythology about it, making some pointers that you've got here a little bit about NRT, maybe making some other pointers about other pharmacotherapies that are valid. So I would suggest that maybe a bit more collaboration with people who do pharmacotherapy for tobacco generically, and remembering a lot of our pharmacotherapies are heavily subsidised, which is excellent. So there's no great costs involved.
Thanks, Renee.
It's all right. Now, the question about the other webinars, for those who don't know this, we do webinars once a month like this in our field in tobacco treatment and smoking cessation. This is a regular activity of the University of Sydney Smoking Research Unit, and we do that on the last Tuesday of every month. And when we finish up here, I will inform you about what the next topic is. Now, that's for us. I'm not sure